Stroke Prevention and Education. Cerenovus, part of Johnson & Johnson Medical Devices companies, is focused on providing solutions used in neurovascular care. Our commitment to changing the trajectory of stroke is inspired by our long heritage and dedication to protecting patients from stroke-related disabilities. Cerenovus has a wide range of endovascular devices for hemorrhagic and ischemic stroke treatment. I am currently the head of worldwide medical affairs at Cerenovus, after working for over 20 years as an interventional neuroradiologist and endovascular neurosurgeon in various European countries. Despite the fact that many strokes can be avoided by living a healthy lifestyle, stroke remains the world's second largest cause of death. We want Cerenovus to be available for people who have suffered a stroke so that they can resume their normal lives. A stroke happens when a blood artery transporting oxygen and nutrients to the brain is either obstructed or breaks. There are two types of stroke, ischemic and hemorrhagic. A stroke occurs when a blood clot forms in a brain artery and prevents blood flow. These strokes are caused by a burst brain aneurysm or the rupture of weakened blood vessels. Devices that stop the bleeding can also be used to treat this type of stroke. Stroke affects Black Americans disproportionately, with their risk roughly twice as high, according to studies. Stroke risk factors disproportionately affect Black patients, who have worse results in terms of timeliness and access to stroke care. By raising stroke awareness, providing healthy lifestyle guidelines, and teaching on risk factors and how to detect the signs and symptoms of a stroke, we can help communities of color reduce the burden of stroke. Why is stroke, in the vast majority of cases, so simply preventable, and how may people reduce their stroke risk? Maintaining a healthy lifestyle, like with other health concerns, is the most obvious technique for lowering your stroke risk. Stopping smoking, eating a nutritious diet, and exercising frequently can all help with high blood pressure, diabetes, obesity, and atrial fibrillation, AFib. In this field, we often say that time is brain. The more time passes, the more brain cells die, limiting the chances of rehabilitation or survival. What role in the treatment of stroke patients does Cerenovus play? Mechanical thrombectomy, MOUNT, has been demonstrated to be helpful in treating ischemic strokes caused by blood clots, with more than half of stroke patients regaining functional independence. During MOUNT, a catheter is inserted into the femoral or radial artery to remove a clot from a patient's artery within the brain. Depending on the type of hemorrhagic stroke, interventional treatments to stop the bleeding may be performed. Cerenovus offers a broad array of devices used in the endovascular treatment of both ischemic and hemorrhagic strokes with the goal of reversing or stopping stroke. Simply said, the longer a stroke goes untreated, the greater the risk of long-term damage or even death for patients. Do you believe the number of people who have a stroke each year could be lowered if more people were aware of the risk factors for stroke and could recognize the signs and symptoms sooner? I believe that raising awareness of stroke signs, symptoms, and risk factors will reduce the number of people who experience long-term disability as a result of a stroke. He is currently the director of Cerenovus's Global Medical Affairs.
Thank you for watching. Hope you will like the video I created for you. Please support me, click on subscribe. Then click on the bell. Please tap the below to view videos of the same series.